Hello guys, I hope you're right. Today we're going through some infections revision, and the first thing I wanted to start with is macrolides. So macrolides are medications that end with MYCIN. So any drug that really ends with MYCIN generally will be a macrolide. Now with macrolides, they infamously cause hypokalemia, as well as increasing the risk of rhabdomyolysis when given with statins. Okay, so this is the first point I want you guys to remember. Now why? So for example, when you have statins or simvastatin, you cannot give simvastatin more than 20 milligrams of simvastatin when giving with amlodipine or diltiazem. But why? Because amlodipine and diltiazem are CYP substrates and inhibitors, which will increase statin levels. So this is a very, very important point to understand. So understand that amlodipine and diltiazem are CYP substrates and inhibitors, which is why they increase the plasma statin levels, and that's very, very important. So let's use that example to understand why when you give macrolides or when you have macrolides with statins, you must pause the macrolide therapy. You must pause the statin therapy and keep the macrolide, because your priority would be solving the infection rather than the hypercholesteremia, because generally hypercholesteremia is more of a long-term issue than infections. Infections generally tend to be short-term. So after the 5 days, then you can reinitiate statins. Now, when we look at statins, there are important things that you need to check for. If someone has muscle breakdown symptoms or muscle pain, measure liver enzymes. Okay. So the reason why you measure the liver enzymes is because you want to verify if what's the reason why they have the muscle breakdown. Is it because of the statins? Is it because another reason? So generally, if the creatine kinase levels, which is a liver enzyme biomarker, is greater than or equal to 5 times the allowed upper limit of normal, that means you'll stop the statin and remeasure after 5 days. If the creatine kinase levels are still greater than or equal to 5 times the upper limit of normal, then you would not reinitiate the statin and you would stop it completely. And this is very, very important to understand, right? So liver enzymes are a very, very important measurement in the context of the exams, because you can find out a lot of things from it. And think about it, if someone has muscle breakdown or muscle pain symptoms, how would you really know? Right? So the way you would, or if someone had muscle breakdown internally in the body, how would you measure that? You would need to measure a biomarker in the body. And this biomarker, depending on the level of it, would prove if this person is experiencing muscle breakdown or rhabdomyolysis. Thank you so much.